say, do what you need to do, what you gonna do.
What are some treatment options for someone who came in, they had a test done, and the cells is leading towards them possibly having cervical cancer?
Okay, what we have is an array or a gamut of things that can happen. So you come and you have your pap smear. The pap smear is abnormal. So if we get an abnormal pap smear, it will tell us certain things like, and you'll hear these words thrown about by the doctor, CIN1, CIN2, CIN3, or invasive cervical cancer. What this all means is that somewhere on the spectrum of cancer you fall. So what it's looking at, so what we have to do first is when you get the abnormal pap smear, the next step would be to do a colposcopy and a biopsy. And what the colposcopy and the biopsy is we are looking at the cervix under a microscope. And when we look at the cervix under the microscope, we are looking for any abnormalities under the microscope that we as gynecologists are trained to look for. If we see abnormal spots on the cervix when we're doing the colposcopy, then we biopsy it. And we direct the biopsy to where we see the abnormalities are. Once we get the biopsy back, if the biopsy comes back and it says you have CIN1, CIN2, CIN3 or invasive cancer, then we can tailor the treatment based on the results of the biopsy. So what all that means is, if you have CIN1, it's saying that there are abnormal cells in the cervix occupying 1/3 of what we call the epithelium. CIN2 is 2/3. CIN3 means it's occupying the entire epithelium, but it hasn't breached it yet. So CIN3 is what we call carcinoma in situ or cancer in situ. So the cancer is still limited to the cells and it haven't gone out. Once you go out of the lining of the epithelium, then you get into invasive cancer. So up to CIN1 and CIN2, we can treat with what they call cryosurgery. So what they do basically is freeze the cervix. You come in and you have a little apparatus, you put it in the cervix, you freeze it, and those abnormal cells slough off, and when it regenerates, pretty much you're cured. If it's a CIN3, where it's occupying the entire length and width of the epithelium, then you have to cut it out. So what we do is what we call a cone biopsy. And with the cone biopsy, we want to cut out the entire lesion and remove it. If you do a cone and you have good margins, good clear margins with the cone, then basically you have cured the patient, and that would be cancer in situ. It hasn't gone anywhere yet. Once the cancer breaches the epithelium and it starts invading the underlying tissue and the vagina and the vaginal wall, then you have cancer stage 1, cancer stage 2, cancer stage 3, and you're entering into some bad and disastrous territory. However, if it's early stage cancer like a stage 1, you might get away doing a hysterectomy, and then after the hysterectomy, depending on if you have involvement of your nodes, because the cancer can spread either through what we call the lymphatic system or through the blood or just by adjoining tissues. So depending on what you have, you can do a hysterectomy, remove as much of the cancer as you want, and then we might have to do some radiation for the patient.
So what advice would you give to ladies who have not yet had a pap smear, or they just delay the process?
Best advice for any young ladies, especially if you're dealing with the ladies of Trinidad and Tobago, considering the high incidence of cervical cancer in its population, is yearly pap smears. And women who have not had a pap smear, go and get a pap smear. I think it's the single most important thing in the deterrence of cervical cancer. As I said, if you're having a pap smear yearly, you will more than likely eliminate any possibility of cervical cancer, because we should be able to pick it up early enough so that we can achieve curative options. Now, that is not to say every now and then we'll miss one and it'll be late. But in general, the yearly pap smears, in addition, when you do the yearly pap smears, we do a bimanual exam where we examine the uterus and the ovaries. So not only cervical cancer will be helped by coming for your pap smears, but we'll be able to probably pick up anything that's affecting the uterus and the ovaries simultaneously. And if you're visiting a gynecologist for your yearly pap smear, he will also check your breast at the same time. So you will get 1, 2, 3, 4 different things checked out for the price of one, so you eliminate the possibility of probably the top 4 cancers in women.
Through it all, I hold you close through